Women are twice as likely to develop depression as men, especially during times of hormonal transition like puberty and postpartum. But what about another significant period of hormonal flux, like perimenopause? Keep watching to learn how to assess the perimenopausal hormone changes that cause an increase in depression symptoms and help fix these imbalances using functional medicine strategies. Did you know that about 40% of gynecologists don't screen their patients for depression, despite the fact that it's especially likely for women to experience during perimenopause and menopause? Perimenopause represents a time of massive hormonal change in the female body and brain. In addition, this hormonal shift is often accompanied by big changes in a woman's external circumstances as well. Many women find themselves caring for aging parents, transitioning their children into adulthood, sometimes acting as caregivers for grandchildren, as well as navigating changes in their relationships, professions, and finances. Perimenopausal hormone changes can also shift the way your body responds to stress, lowering your stress resilience and raising chronic stress hormones like cortisol. In short, women have a lot of really valid reasons to develop symptoms of depression or anxiety in perimenopause. In this video, I'm going to explain why it's crucial to recognize the hormonal changes that happen during perimenopause and how a functional medicine approach can help you both assess and relieve symptoms of depression during these transitional years. But before we dive into the nitty-gritty of hormone change during perimenopause, I think it's important to review some of the symptoms of depression, because you could have depression even if you don't have feelings of sadness or you're not crying all the time. Depression can also present with symptoms like fatigue, mood swings, loss of motivation or interest, poor sleep, irritability, lack of concentration, brain fog, and other non-specific signs like changes in appetite, weight gain, or weight loss. If you or someone you love suffers from symptoms of depression, you're well aware of how much it can impact your daily quality of life. Yet all too often, these kinds of symptoms are brushed off as just stress, and women are only given two options: deal with it on your own or take an antidepressant medication. Thankfully, there's a lot more you can do to support your brain, mood, and overall well-being during perimenopause, particularly by assessing and addressing hormone balance and changes. So, what exactly is happening to your hormones during perimenopause? For most women, this time is characterized by wildly fluctuating estrogen levels and declining progesterone levels. Sometimes the drop can be pretty severe. These hormone changes can set you up for several different imbalances. If your progesterone drops faster than your estrogen, it could result in estrogen dominance. Progesterone is the calm, cool, collected hormone that balances fiery estrogen, and it also helps you get restful sleep. When estrogen is dominant, it really impacts mood and cognition. Think anxiety, irritability, tearfulness, as well as brain fog, trouble concentrating, and even short-term memory issues. And let's not forget about vasomotor symptoms like hot flashes and night sweats. In fact, if you have these kinds of symptoms, your risk for depression doubles. Estrogen levels can also suddenly or intermittently drop. Before perimenopause, your ovaries are in charge of making the large majority of your estrogens. But once ovarian production starts to falter, your adrenal glands and fat cells are supposed to pick up the slack by making estrogen from a prohormone called DHEA. DHEA is made by the adrenal glands, along with cortisol, your chronic stress hormone. Cortisol is made in response to the brain's activation of the stress response system, also known as the HPA axis, when you're experiencing mental, emotional, and physical stress over a long period of time. Cortisol can also be elevated as a result of past trauma. But if your adrenals are making lots of cortisol because of chronic stress and HPA axis activation, they may not be able to make as much DHEA. So you don't have the ingredients you need to make estrogens, and low estrogen levels are a significant risk factor for depression, as is chronic stress. And if this wasn't tricky enough, high cortisol also directly inhibits production of estrogen and progesterone by the ovaries. It's a triple whammy of hormonal triggers. The other important thing that scientists are learning about estrogen is that it buffers or protects the brain against stressors, both psychological and physical. So when estrogen gets too low, your cognitive performance or brain function can be very impacted. These can be symptoms of depression too, like loss of focus, attention, memory, and motivation. Even in menopause, you're not supposed to lose all your estrogen support. Again, remember that the adrenals and fat cells make estrogens too. Estrogen is crucial for protecting not just your brain, but also your bone and cardiovascular health. So while the perimenopausal and menopausal transitions are a natural part of life, it's not natural or normal to have zero estrogen. Estrogen also regulates the way that glucose is used in your brain. Studies have shown a decline in glucose utilization in 80% of women beginning in their 40s. Interestingly, this is not seen in men. Poor glucose metabolism in the brain leads to slowed function or low brain energy that very much characterizes the cognitive symptoms of depression. How can you tell if these hormonal shifts are contributing to your depression symptoms? Well, this is where testing comes in, and I don't mean blood testing. Serum lab testing is not a great way to measure hormones like estrogen and progesterone, particularly in perimenopause. However, dried urine testing can be used to assess key things like, is your progesterone declining? Are you detoxing or clearing your estrogen appropriately? Do you have adequate DHEA production to make hormones outside of the ovaries? Is your cortisol elevated enough to inhibit your other hormone production? Are you a good candidate for low-dose estradiol or progesterone supplementation? You can even assess your risk for problems like androgenic alopecia and breast cancer utilizing comprehensive urine hormone testing. This data has helped many of my clients get to the root of their depression symptoms during perimenopause, not to mention other symptoms too. I'll put some info about how to get your hands on a test kit in my Perimenopause and Depression checklist. You're welcome to download this resource for free. I'll put a link to grab it in the video description. Hopefully now you can see that there are more options for treating depression in perimenopause beyond SSRIs. Let's talk through a few of them. While hormone replacement therapy isn't appropriate for everyone, transdermal estradiol supplementation has excellent efficacy for treating depression in perimenopause. It's actually more effective during this time compared to later in menopause. So if you're a good candidate, recent research suggests that starting to supplement during this transitional time has greater benefits specific to depression symptoms. I'd like to specify that I do not recommend conjugated equine estrogens for this purpose, as they have different actions in the body compared to bioidentical human estradiol. Talk to your doctor about transdermal estradiol cream or patches, especially if you also have vasomotor symptoms like hot flashes and night sweats. If supplemental estradiol isn't a good fit for you, perhaps because you have a history of hormone-sensitive cancers, you might consider plant-based supports that activate other estrogen receptors. There are now 6 separate documented types of receptors. For instance, the beta estrogen receptor helps regulate mood without risking potential inflammation or proliferation. My favorite way to safely support estrogen activity via this receptor is with an extract of Rapontic rhubarb. It's also an excellent way to relieve hot flashes and night sweats. I'll put a link to my favorite practitioner-grade form of this lovely estrogen support in the free checklist. Again, the link will be in the video description. Because women rely heavily on DHEA for hormone production, and DHEA is hugely influenced by stress, it's absolutely crucial to address the HPA axis in cases of perimenopausal depression. Reducing cortisol if it's elevated and restoring stress resilience is a big project, but there are hundreds of evidence-based functional medicine strategies that you can use. Some of my favorites include yoga, sauna, 4-7-8 breathing, meditation, humming, and creative activities like singing, dancing, and making art. If you're looking for more specific suggestions, including things like nutritional support and adaptogenic herbs, check out my Stress Better mini workshop. I'll put a link to more info in the video description, along with the free checklist. If you only take away one thing from this video, I want you to know that if you're suffering from depression or other hormonal issues during perimenopause, you have evidence-based options to address your symptoms at the root cause, instead of just managing or band-aiding them. I hope that you found some actionable next steps to take in this video. Be sure to check out the video description for links to my free checklist and other resources. And if you did get some value from this video, I'd really appreciate it if you'd hit that like button and subscribe to my channel. Thanks so much for tuning in, and we'll see you over in the next video.